It's time to get ready for open enrollment in the private insurance marketplace. This is the annual open enrollment period to buy individual health insurance at healthcare.gov. This is the website you're going to want to make sure that you visit sometime between November 1st and December 15th. It's 6 weeks that open enrollment is open, and it's very short and it goes by fast. This will be the time to buy coverage that becomes effective January 1st, 2019. So keep healthcare.gov bookmarked on your computer and make sure you visit it at some point between November 1st and December 15th. As you're preparing for November 1st, there is stuff you can do to get ready now. Get organized, get some information together that you're going to need when you fill out your health insurance application form. And it's just like shopping online when you apply for coverage. You're going to fill out demographic information. You're going to talk about your family, what that looks like. It's like doing your taxes, only not as comprehensive. You're going to put in information about what your sources of income are, wages from jobs, tips, salary that you're taking home, other sources of income. Then you're going to have to answer a couple more questions about if you have access to health insurance through your work or through other sources. You're going to be doing a survey that is presented question by question online and submitting it sometime between November 1st and 15th. But if you have all this information ready in advance, you're going to be able to go through that interview much faster. Here are things that we have found to have handy. We get ready, go find it now so that when November 1st comes around, you can sit down and you can knock this thing out in under an hour. Household information. Who is in the household and who counts? There's different ways of counting who is in your household, and healthcare.gov is going to help you sort that out. They also have tools that you can tell who is in your household and the relationships, and they'll tell you who should count and who shouldn't. So get basic information together, generally following the lines of tax dependency. That's what's going to matter most on the healthcare.gov application. So if you have last year's taxes handy, get those. Other household information like the names and birth dates and social security numbers of everybody in the house, get that ready to go. Have it on a slip of paper so that when you get to that question, you can just glance over, type it all in. Income information, having some pay stubs handy would be nice. If you have sources of income that varies, if you're self-employed, make sure you have notes on that. Again, last year's taxes might be quite helpful for getting that information organized. Current coverage information. Are you offered insurance through work? Have you been offered insurance but you haven't taken it? Have information like that handy so when you get to those questions, you can breeze through it. Finally, if we didn't say it twice already, we're going to say it one more time, tax information. The way that healthcare.gov figures out eligibility for insurance and for premium assistance is by looking at a lot of the information that happens on your taxes. They use what's called the modified adjusted gross income calculation, and that AGI of the MAGI, the modified adjusted gross income, actually comes from the way that people file their taxes, the adjusted gross income on your taxes. There are a couple tweaks made to that on the healthcare.gov application, but essentially you're using your tax information. Now, if you have health insurance through the marketplace right now in 2018, you have the option to just keep getting that insurance that you're getting now. It is, if you do nothing, you actually will be re-enrolled into a plan that you have now or a similar plan. We recommend that you don't do nothing. Here's why. First of all, you might need to update your information. Has your pay changed? Has the family size changed? Is somebody no longer a dependent that was last year? There could be changes that you haven't recorded, and now is your opportunity to do that. Income changes, household sizes, those changes could impact how much you get in tax subsidies. If you don't reconcile it now, you're going to have to reconcile it on your taxes, and that could mean penalties for people that got it wrong. Now, also, the insurance that you have right now may change in price, it might change coverage, and it might change network. So if you just stay with the plan that you have now, thinking it's going to look exactly the same in 2019, you're probably going to be wrong. Most insurance plans do some sort of tweaking to their coverage network. Some might just switch to a whole new hospital altogether and new providers, and you could keep going to the same doctor you've been going to and all of a sudden find that when you auto-renewed your coverage, you are now out of network. So pay really close attention to the details of the plan you had in 2018 and whether or not you should renew in 2019. Healthcare.gov makes it easy for you to say, I have coverage in 2018, I just want to update my information. You can do that, and you can still pick a new plan when you do that. So it's worth logging into healthcare.gov, assessing if the coverage you have in 2018 is something you want to continue or if you want to shop for a whole new plan. Remember to shop and compare. This is a good time to do it. It's good to start early. Healthcare.gov will get bogged down the closer we get to December 15th. Most people procrastinate and wait till the last day. Try to start early. Start in November so you give yourself plenty of time to get started. You're going to create a profile, give a username and password, and log in. Save that information so you can come back to it at a later date, and you can continue to shop and compare and finish your application. Once you're done with that, make sure you pay your first month's premium on time, and you are good to go for coverage for 2019. We're sharing a couple links with you here that are going to be helpful. First link, of course, is healthcare.gov. Second link, the Marketplace Application Checklist. CMS and HHS make this available. It's a list similar to what we showed on our screen with birth dates, social security numbers, insurance forms, tax forms, things that are helpful to have handy. And you can print out that list and you can use it as a virtual checklist and go collect the information you need. So when you sit down to fill out your application, you have it all in front of you. Reporting changes to the marketplace, we mentioned, we give you instructions on how to do that. If you're someone that has had a life change, an income change, a family size change, we walk you through how to report that to the marketplace. And finally, if you think you need a little boost, we give you the link to find local help. There are people in the community that might be able to help. There's also a phone number where you can call the marketplace itself and ask for assistance as you go. You can always send us a question or share your healthcare story at healthwatchwisconsin.org.